as we take a look back over the last 2 months. With more than 8 lives in lockdown, we have thoroughly enjoyed ourselves interacting with some of the best minds in the dental fraternity. I'd like to take you on a little journey which showcases the last 8 weeks with some of our amazing experts. It all started with the first live on aerosol generating procedures with Dr. Nikhil Deshpande.
So, just to know, are you already practicing aerosol procedures in the clinic?
Yes, now for 3 weeks now we have been doing aerosol procedures, or we are trying to minimize the aerosols for sure. I mean, it's not like we've gone back full-fledged like we used to in pre-COVID times.
We then moved on to talking about rubber dam protection with Dr. Tawfiq from Egypt.
So imagine that you're dealing with the patient's saliva and you are so close, even if you're wearing too much protection, how percentage you will be safe if you're using rubber dam. I'm not talking about the quality or the benefits of the rubber dam regarding the quality of your dentistry. I'm talking about how you can use it for your protection. And also, if you had patient before that complaining about the rubber dam and it hurts, now he will accept that if you introducing this kind of procedures as a protection for him.
We then invited Dr. Adarsh all the way from Australia, who spoke to us about contactless patient booking.
Once again, pre-booking. We talked about pre-booking some time ago. That is essentially making your practice contactless, because essentially no one has to pick up the phone. The patient already has an appointment in the book, and he gets an automated email 2 weeks in, 2 weeks out of the appointment. If he can't make it, he just sends you an email back saying, and now the patient has the ability to go online and make.
After this, he was even kind enough to give us a bonus clip on infection control with Dr. Adarsh Pishrodi.
Instrument reprocessing, like sterilization, the autoclave, we call it autoclave. I know it's called autoclave some places, but just buying the best autoclave or autoclave doesn't really solve the problem. You need to be monitoring it. There are daily, weekly, and annual tests that you need to do, and you need to be aware of. What is a vacuum test? What is a helix test? What's the Bowie-Dick test? All of these things are not very clear. A lot of people don't even read the instruction manuals, and they're reliant on the technician telling them what to do. And sometimes the technician can be wrong.
We then invited a lawyer for discussing the medico-legal practices for COVID-19, and that was advocate Malika Nurani, who navigated for us the challenges that a dental practice would face in keeping themselves medico-legally absolutely safe.
If you could tell us what are the steps, that any dentist or even a doctor, if they're listening in, what can they do to protect themselves from any kind of COVID-related claim?
So my first recommendation would be definitely, read through those. The Dental Council of India, I believe, has also issued a form of guidelines which is based off of the Ministry of Health and Family Welfare's guidelines. So definitely read those two documents as just kind of being a guiding, guiding document for you to start up your practice.
We then spoke to Dr. Manish Chitnis about financial planning and safety for COVID-19.
So is there any tool or anything that you can give us which can help us plan things better?
Yes. And I'm going to probably touch two topics here very quickly. And as we say, if you don't plan well, then there is a chance of failure. And what was that word? Fail to plan to fail. That's what the situation is with money, because money is finally money and it doesn't come out of thin air. So what I really need to calculate is two things, and this is where I'm teaching at the moment, or sharing, that's the word, of reverse calculations. And the reverse calculations are this. Let's say I'm going to treat 50 patients for the month with the amount of hours I have. Say just like a number. I was treating 100 patients, but I'm now treating 50. And my PPE cost, I'm just going to call it for argument's sake, is 100 per patient.
We had Dr. Shivangi guide us through geriatric patient management.
Doctor, I wanted to know what are those precautions that you're taking, since we spoke about how elderly patients do tend to have a higher risk in these current times.
See, first of all, I think a thorough history taking, if you haven't done that earlier, is a must. Because first you have to understand where do they lie in the risk profile. Are they mild, moderate, or high?
And finally, we took a different approach to building some mental toughness and take a different perspective on success in dentistry in COVID times and beyond. And that was with Dr. Bendre, who guided us to be looking at life in a different way.
So how has, the past few months, like I always start all my interviews with this question, because I think everyone is coping differently with the current times. And I wanted to know, how have you been over the last 3-4 months?
It has been a big break, B-R-E-A-K, and a big break, B-R-A-K-E. So it's been a really something which we have never imagined. Such a nightmare is in front of us. There is a lingering risk to the entire world. And we have seen really catastrophe moving from one country to another. And everything is collapsing. Everything is uncertain. What we lived as a reality 4 months back seems to be a dream now.
So if you have missed any of these, please be sure to check the links below and actually watch any of them that interest you. We are planning to continue this journey as we go along, and we would love for you to give us your suggestions as to who you'd like to hear speak to us next and which topic bothers you about going back to practice or about the current protocols in COVID-19. We'd be happy to see more of your interactions, questions, comments, likes, and subscribes. Keep them coming. Thank you so much, and looking forward to more lives in lockdown and